This is diabetic management insulin pump. I have prepared all supplies. I've checked the medication for right med, right time, right route, right dose, and right patient. Hi, my name is Dana. I'll be your nurse. Can you verify your name and date of birth? Perfect. So today I'll show you how to use an insulin pump. So we'll start with the pump itself. We have a pump, and the insulin will be delivered based on a basal rate that will be determined. For example, 1 unit per hour or as directed. So we're going to first, we're going to draw up our insulin, the desired amount of insulin as prescribed. We're going to remove the cap from the syringe. We're going to inject the syringe into the insulin vial. We're going to draw our insulin, the desired amount of units, keeping all air bubbles out, and if there are any air bubbles, then you're just going to tap the syringe to remove them. Perfect. Alright, then we're going to take our insulin cartridge. Actually, before we do anything with the pump itself or the cartridge, we're going to recap the syringe using the scoop method. We're going to remove the syringe, and we're going to discard that in our sharps container. Next, we're going to place, there's a white cap that came in the packaging with the pump. We're going to place that white cap on top of the syringe, along with, there's a black cap on the top end of the insulin pump. We're going to remove that. We're going to place that on our syringe. Okay. Now, we're going to take the infusion package, remove the cannula and the tubing from the packaging. Before we do that, actually, we're going to locate the injection site. We're going to use your abdomen. We're going to make sure that's at least 1 inch from your belly button. And I'm going to take an alcohol, and before I do that, actually, I'm going to don gloves. We're going to take an alcohol pad and wipe the incision area, or an aseptic solution that is preferred by the facility. We're going to make sure again that we are at least 1 inch from your belly button and away from any areas around your belly, your belt line. We're going to wipe that area. All right, and we're going to discard our wipe. Then we're going to take the infusion package. We're going to remove it from its packaging and throw that away. Next, you see here that there is a needle in the middle of this device. You're going to want to make sure you stay away from the needle just to make sure it remains sterile. You're going to remove the tubing from around the needle portion. Okay. Once that's done, you're going to turn your equipment upside down. Turn the pump, the cannula with the tubing upside down. You're going to, before that actually, you're going to remove the cap from the needle in the middle. You're going to place the entire device onto your abdomen at the specified location. You want to press the sides, and this is going to inject the needle, and you're going to feel a slight poke. So we're going to squeeze the sides. The needle is going to inject into your skin, and then we're going to remove that part of the cannula. So what's going to remain is the cannula itself along with the tubing. We, at this point, need to prime the tubing. So I'm going to remove the tubing from the cannula. I'm going to insert, actually before, we're going to remove that tubing, but we're also going to place our syringe cartridge into the pump itself. And then we're going to connect the tubing to the pump, and we're going to prime it. So you want to take your pump, go to your menu setting, go to prime, and you're going to know it's primed when maybe 4 or 5 drops come out of the other end. Good. So now that that's primed, we're going to reattach the tubing to the cannula, and then we're going to prime the cannula, and we're going to follow the same steps. Perfect. So at this point, your insulin will be injected again at a basal rate, determined by how you feel comfortable measuring your caloric intake. And then I'm just going to document here the infusion site, the type of insulin, the pump, your status and any adverse effects, and everything that we've educated you on today, that will be documented. And do you have any questions?